identify the movement which really causes the impingement, we retrain those movements, we retrain those muscles which are loading the tissue, and therefore the key thing is it reduces recurrence. That's the concept of kinetic control, and that has really changed my practice.
Just love what you're doing, enjoy what you're doing. That's very important. Don't do it out of stress. And I think if you love what you do, you enjoy what you do, you will reach wherever you want to reach. That's the way I look at it. I'm Dr. Hemakshi Basu, been practicing for 30 years now, and I've had a long journey. It was a great journey. I love what I'm doing. So I started with, I graduated from KM Hospital, went and decided to do my masters in University of South Australia, Adelaide. I did my masters in manual therapy, and also did a lot of work in Pilates, where there's an Australian body called APPI where I've done my Pilates from. And I think the combination of manual therapy and Pilates really grew my practice a lot. What I really wanted to do and share a lot with the physios back home. So that's how I started teaching, and I just realized that what I had not learned at undergrad level, but I think it's a must to do your postgrad, or you have an international experience, because I think we all end up sharing a lot more stuff. Here people don't want to share, and I guess that's what I did when I started teaching. I taught everything I knew, just so that we can become better therapists and can have a better relationship with our orthopedics, which we always had trouble with. And I think then in 2015 I decided to realize that there's something more, where I was missing something, and kinetic control came into my life, and I thought movement analysis and movement rehab or retraining, as we call, is great. And I think that completed my practice, besides whatever we did with McKenzie, and I did my balanced body reformer from UK. So I think over a period of years, I've added a lot into my basket. Who better than a physio can understand movement, overall, because we do, the science behind it. And I think all our activities is moving around. So that's what I've done in the last 30 years.
Ma'am, can you elaborate more about kinetic rehab?
Okay, so it's not called kinetic rehab, we call it kinetic control. So it's a concept, all started by Mark and Sarah in UK, and the whole concept is about movement and movement impairments. For example, it teaches you a systematic way to evaluate, assess and diagnose movement impairments, which stresses on certain tissues or loads certain tissues, giving you pain and dysfunction. Now in school, what they used to teach us is that, okay, you got a shoulder impingement or you got supraspinatus tendonitis. But why do we get this? So kinetic control literally gives you an idea through the different movement impairments which causes the stress on these tissues. So it's easy to diagnose and it's easy to treat them, because normally we would just ultrasound it or we would give some random exercises. But here once we identify the movement which really causes the impingement, we retrain those movements, we retrain those muscles which are loading the tissue, and therefore the key thing is it reduces recurrence. That's the concept of kinetic control, and that has really changed my practice.
Ma'am, you had a long experience in this field. You worked for many decades, I would say. So how have you seen the perspective of patients or other people change about physiotherapy? Because it wasn't the same a few years back, I would say that. So how have you seen that being in the field as a physio?
So I think, yes, it goes many years back, because when I decided that I wanted to do physio, everybody didn't even know what physiotherapy was, and they thought it was just exercise therapy or massage therapy, and they, why are you getting into it? Nobody knows what is the future. But what fascinated me, that I just felt that we as physios could give better quality to our patients, whether it is pain, whether it is walking them through a neurological problem, or whether it's chest condition. I think we really could give better quality to our patients, and that's why I decided to start physio. And trust me, it was a tough time to tell people, because nobody knew what we did. And I think for many years, still a lot of people don't know what we do. So a patient comes to me and says, okay, I've treated for the spine, and then they say, do you treat headaches? And I was like, yes, it's a part of my field. So I guess it's over a period of time, we've educated our patients. Patients have become more aware now. And I think because we as physios have also evolved, and when we explain to the patient what we do and what we can get results, what results we can get through, I think the patients have become more aware. And earlier they would always go to the orthopedic first and then come to us, but I think that has changed now, and I'm really glad about it. And I think there's nothing wrong to see an ortho first and then us, but I guess over a period of time, our rapport and a relationship with the ortho and the physio has also become better. And the reason is that we have started doing better quality work. That's the way I would look at it, because I think the orthopedics had a really bad impression because we also didn't give that great results, right? And now, and I'm very proud. I think a lot of the younger generation who comes out, I feel they knew much more than what I knew when I was at undergrad level. So I think the colleges are also doing well, and the kids have also become a lot more aware. So I think because it's an equal sharing of what we can do and what we deliver, I think the patient awareness has become a lot more, and I think that's a good sign. It's a good thing.
Ma'am, you are one of the founder members of the Academy of Rehab Sciences. Could you elaborate what it is and what are the functions of the Academy of Rehab Sciences?
Okay, so during our time, we didn't have anybody to teach us after we graduated. So to upgrade our knowledge was very difficult. A few of us who had done our masters from different parts of the world decided to get together and teach. See, in college you always get a good download of medical knowledge, but when as a physiotherapist you're thrown in the real world, you realize that you're totally lost. Your clinical application skills are not as great as it should be. So when we started this academy, our aim was to teach really good quality knowledge, treatment techniques, concepts which the physios, when they go back to work the next day, can apply. And that was the thrill we got by teaching. And I think we're really proud that we've done a really great job so far.
Ma'am, how do you approach a particular case? Like how to think like a physio if someone comes to you with any kind of pain, for example, a shoulder pain. How is your mindset to approaching that particular condition? Because this is something which we don't learn as students. We just give the modalities as it is.
Okay, so this is nothing but clinical reasoning process. It's an evaluation which starts right from when the patient walks into your clinic. Okay, so when the patient comes in, you will observe their posture. How are they, for example, if the shoulder, then you will observe the shoulder posture. Are they too rounded? Are they too droopy? How are they sitting? You will observe all that. So observation is the first part. Second is your physical examination. Your subjective examination. Your subjective examination is nothing but data collection. Now, we don't want to only collect data, but we need to understand why we are collecting and are we relating to the patient's symptoms. So, why is the pain increasing? What are the factors which are easing the pain? Is the pain constant or intermittent? You will also ask on a pain scale from a 0 to 10, what is the intensity, severity of pain? So, these are important questions. Next important question is, how did it start? What is the mechanism of injury? So, you need to get all this information and relate it to the patient's symptoms and disability. The next, third point is your physical examination. Your physical examination is, now you've understood whatever you asked and communicated, the questions which you've asked. You now decide what are the structures you're going to examine. So if it's a shoulder, what are the active range of motion tests you're going to do? What are the passive range of motion tests you're going to do? What are the resisted static contraction tests you're going to do? Muscle test. neurological test, nerve test, special test. So you're going to decide all this and examine the patient. Finally, you need to do the management, which is your treatment. You focus on the treatment depending upon, you need to prioritize what you're going to treat day one. You can't treat everything. So you have to understand that this is what I need to treat. Like if you feel that there is a certain movement which is giving you a problem, or there is a droopy shoulder, for example, in case of a shoulder, or the posture of the shoulder not great, and that's contributing to the pain, you will then concentrate and your management will be on correcting the shoulder. Now whether you correct it with tape, whether you correct it with exercise, or you make sure that the pain comes down by doing certain modalities. However, I am not a very modality person. I feel that when you do your treatment with exercises, it works better. We are looking not only at short-term goals, we are looking at long-term goals.
Recently, I just had a little lecture at KM Hospital, and I did a 2-3 hour just on how to analyze the shoulder pain and how to work towards it. Actually, when you're an undergrad or when you're in school, they just tell you very technical things of the shoulder. And for example, when you talk about the shoulder, they'll just tell you how to palpate, what tissue is structured. So everything theoretically are very good, but practically we don't really analyze. So normally I would say, to put it into a nutshell, that most of our shoulder cases are usually posture related, and it's a lot to do. And because if my shoulder is not positioned well, I think it always gives me a lot of neck issues too. So the first thing which I would really evaluate is look at your shoulder and your posture. And I am so much into movement. So most of us, like say you've got a great shoulder position, but I think none of us here have a bad one. But most of our patients have like what we call a droopy shoulder, or a downward rotation of the scapula, or an anterior tilt of the scapula, which leads to a lot of impingement issues, instability issues. It causes a lot of inhibition of your lower trap, serratus, and therefore gives you a lot of neck issues also. So I think once you analyze the movement of flexion, rotation and abduction and understand the position of the scapula, I think that gives you a lot of information that what I need to do. So I need to make sure that my scapula is into upward rotation and not downward, and that's my normal position, and therefore that's going to activate my serratus, my lower traps automatically. And then we as physios train them how to work better or how to activate the muscle better. So that's how it goes through. So you start with activation, and then you start with loading depending upon who is the patient. Like if there's an athlete or an office going, so whether they need a lot of loading, whether they need a lot of repetitive movements. So whether I want loading principles, I want strengthening principles, I want stability principles, I want to work on plyometrics. So I think when you analyze the movement better, then everything goes step by step, and you can make sure that the shoulder pain doesn't come back to if you've done your best towards the patient. So that's the way, I mean, it's to put it in a nutshell. Otherwise it's a long history which you can go through. So
ma'am, and you have done your post-graduation from Australia and you came back to India. Many students now they think going back abroad and practicing there is much better. So what do you think, which is better, and why did you come?
I think that's a good question. I think so my plan was not to come back because I had gone on a big loan, and I thought I'll go to America and work as a physio, earn some money, and then come back. But I think unfortunately at that time there was a huge medical crisis, and so I had to come back to finish all my paperwork and then go. And I realized that I was going nowhere because of that medical crisis. And so then I started my journey from Harkishan Das Hospital, where Dr. Chavria, where I was introduced to, and he was like my mentor. And I just realized that I just started loving what I was doing. And once you start something, I think you need to take it to another level. As much as America, Australia gives you a lot of money, but job satisfaction and the experience of the number of patients you're going to see is by far better over here.
Ma'am, can you elaborate a little bit about the struggles which you have faced, and what can the young students learn from it? Because 30 years is a very big...
So struggle, it is a good struggle. It's not like something really bad. It's just that I would just tell the young generation that you need to be very hardworking. You need to trust yourself and be very confident. Okay, and I'm very positive, and I like to take risks. I feel what are you going to lose? Nothing, So if you can put yourself to that level, I think that growth will just come in. So the struggle was just that how I would educate my patients. That was a struggle to do what I'm doing, and how I would educate the doctors and my fellow colleagues. I think that struggle was over a period of time, and because I was very determined that I want to change the look and outlook of the others towards the physiotherapist. So that's why when I came back from Australia, yes, there was not much of income, but I made sure that I worked towards that, and I think that gained a lot of respect. So a lot of patients, a lot of doctors started respecting what I was doing, and I think then it became a lot easier. I mean, so initially it's really tough because everybody's against you. So I always feel that very politely, very nicely, but very firmly and confident of what you're saying is what you need to interact with the patients as well as the orthopedic surgeons. That's where you come across. And I think when that changes, everything changes.
How to develop the soft skills, because there are different kind of students across India, who are introvert, who are shy, who don't like to talk to patients. So how to develop that soft skills talking to the patient?
Yes, this is very, very important in our profession. As physiotherapists, that we always have to talk, right? We need to talk to patients to get information about them, about what their problem is, and then we also need to communicate well to understand the subjective examination, the physical examination, and then come to a diagnosis. Now, if a lot of us, what happens, we know our subject really well, but we can't put it out in clinical practice. And this lack of communication talks about lack of confidence. So it's important to be very clear, precise, confidently teaching them exercises, giving them instructions, making sure that they are comfortable. Also, like little things like bedside manners are really important. Most of my interns, when they come to me, I literally push them to talk to patients. Okay, teach them. Okay, you teach the exercise. You communicate with the patient and tell them what to do, so that they get the confidence. Eventually, communication skills will always come with a lot of practice and experience. So I always advise that please intern with a physiotherapist who's got more experience, because that's how they will learn. When they hear them talk, they will learn how to communicate better. So I think this is a skill which is important, and everybody must develop this skill.
Ma'am, you've built a very successful career for yourself. So for many students who aspire to be somewhere near that, what is the secret to a successful clinic? Like you have built a successful patient outflow.
Thank you. So I've already spilled the secret out where I said you have to. I worked very hard, and I will not deny that, and I loved doing that. So a lot of times, like initially when I started working, I didn't look at time, money. I just worked because I wanted that experience. So I worked. So even in the hospital, we had to work for 5 hours, I worked for 5.5 hours. I didn't care. Like if I've given a load of patients, I've done. I've not bothered what you're doing. I just did what I wanted to do. So I feel if you have that hard work, sincerity, diligence, and if you, the first 5 years, don't look what's coming. Just get your experience. That's the way I wanted to build. So I started my clinic after 7 years of my practice, where all my friends had clinic day one. You understand? But that was not my criteria. My criteria was that once I start, I don't want to look back. So I think when you just keep working by and being confident of what you're doing. Okay, so I was very confident what I was doing. If I'm not confident, I would tell patients, look, I don't know what's happening. So being truthful to yourself, being truthful with your patients is very important. And like I said, I'm a little risk taker. I like to take risk. I said, okay, let's just take it. And at the most, if you're not successful, you can go back to what you're doing. Okay, and when you do well, and my agenda was that if I have one patient, I want to treat them so well that that one patient will get me 5 more. And those 5 will get me 5 more. That's how you grow exponentially. But I was not looking at, so never in my life I've said, okay, I'm going to have this one patient and take them for 10 sittings. So if they didn't need it, I wouldn't do it. even if the doctors would write 10 sittings of diathermy, and I said, okay, I will do what you want, but I know when I can do it in much lesser. So I would do what I had to do. I would still give that diathermy to them, and I would tell the patient that the doctor said 10 sittings. You're fine in 3 or 4. Do you really want to waste time and money? No. Go back to the doctor, tell them. So then the doctor would also realize that, we don't, so the patient realized that I didn't call them. So don't call them if they don't really need to, be truthful. And, if they need more, if they need less. So I feel at the end of the day, if you are truthful to yourself and overall, you'll do great.
Just having the right ethical practice and good intentions.
Absolutely ethical practice, which I have never budged whether I had money and fame or I didn't have, even till date. I think the more you grow, the more careful you have to be that you don't cheat on people and you are still more truthful, because I think that's the one which takes you to a long journey.
And ma'am, how to build a team and what are the qualities you look for while hiring a young physiotherapist?
Okay, so for me, it doesn't matter how knowledgeable you are. For me, it matters how enthusiastic you are, how hardworking you are, and you're doing this. So even this clinic, I wouldn't say it's my clinic, it's our clinic, because all my girls work as if it's their clinic and their patient. So for me, those qualities, even your ethics and your principles have to match. So if I know that you're at the same page, I don't care whether you don't know anything, because I'm there, I'm ready to teach. So that's the way I look up for people. So when they come here, I put them for 4 to 6 months, I will teach them. But if I feel, okay, they are somebody I want to, they're like people who I know will add value to the clinic, then I would take them through. Because I don't know, I feel if you can have the best of knowledge, but if you don't have the right attitude and you don't have right ethics of practicing, and you're not humble with your other teammates, and I feel like I don't work too long hours, I work about 4 to 5 hours a day, and I feel if you can't get along in this 4 to 5 hours a day, then I don't think so you're the right person to stick around. So that's the way I literally choose. I don't choose on what you know, I choose on how you are as a person, and it has worked for me.
Ma'am, you have a degree in Pilates, as you said, so it is a relatively new science. Not many people know about it. We ourselves are not very aware of it. So could you elaborate on how it helps in the recovery process, and what exactly is Pilates?
Okay, Pilates is a great form of exercise. It's my base where I started Physio from, to teach exercises to patients for rehabilitation post any kind of injury. Now there are 2 types of exercises. You have a mat work program and you have equipment. Now mat is where you do the exercise on the floor, and you can use things like small equipments like the ball and the Pilates ring. Equipment is special equipments which are used for Pilates, like the reformer, the Wunda chair, the arc. So both of them together, so it's not only the mat or only the equipment, but both of them work in building a strong core, which is very important for all our patients, whether they have injuries or they don't have injuries. And when I talk about the core, we're not only talking about the abdominal muscles, but we're also talking about the scapula. And it is a great form to either get back to your normal self post-injury, or you can use it to prevent injuries and get back to fitness. That's what it does.
And ma'am, if right now you have a years experience in this, 30 years in experience in this field, if you get to go back with the same mind for a girl from KEM who has just finished her degree, what would her approach be towards the community? How will she start?
Means when if I have to go back?
Yes ma'am. With the same mind which you have right now.
So I have started exactly the way I had my mind. Okay, so I have never, for me, I've never deterred. I didn't care. For me, it doesn't matter what others do. It only mattered what I did for myself and what I did for others. So my mindset has not changed. I have not, my approaches have got better. That is great, because I guess science keeps moving and every year you hear something new. So it's not about the technique, it's about the concept. And I feel physiotherapy is a concept. We have lots of techniques. We have dry needling, we have, you name it, taping, you have cupping and a lot of things. But you have a lot of modalities. Like, I don't use modalities. I've never enjoyed using modalities. So I guess my mindset has not changed. I've just become a better therapist over a period of time.
And ma'am, what all courses would you recommend to do for a young physio?
So as I said, I would see there are lots of courses. Okay, there are a lot of technique courses and there are a lot of concept courses. So I would say Pilates is a concept, kinetic control is a concept, okay, arthro rehab is a concept. So I feel if you do a concept based, manual therapy was a concept as much as it was a treatment. It helps you to analyze. Clinical reasoning is very, very important in our field. So once you've got the clinical reasoning right, then you add all your techniques, like you add your dry needling. It's not that I don't use them, but I explain to the patient that they are just a tool to get you better faster. Eventually it's your exercise. Okay, so if you have to choose between a dry needling or a kinetic control or an Pilates or manual therapy, I feel get the concept course first, understand the reasoning, then do a lot of all your other courses. I think it's important to learn all your techniques, but if you don't know how to apply, what will I do with the technique? That's the way I look at it.
And ma'am, you have also been a part of the hospitals and you have your own clinic. So what do you think which is better?
I think both have their own good things. I preferred the hospital setup first because it gave me freedom to treat a lot of patients. Okay, and it's not that you do trial and error because you don't care about the patient, but you can do a lot of practice. Now when you're doing in private practice, you are a lot more responsible for what you're doing. So you have to be very you can't just do things because you have to do. In a hospital setup, because there are a lot more exposure to a lot more patients, you can practice a lot more. And that's why I prefer the hospital setup first, then a private setup, because you're very new, so you're thrown in this world where your education world and your clinical world don't match. Okay, and when you start your own practice thinking that you're always going to get stuck. There's nobody to share problems and share patient. But in the hospital, you have lots of people and say, okay, fine, I'm stuck with this. Can you help me out? So you also learn from your colleagues, plus then you know what to work with your patients. So I think I would prefer a hospital setup first, or if you get a clinical setup where I was lucky to get a really good clinical setup in terms of private practice. So I did my private practice and hospital setup together. And so I learned in both the places together. In your private setup, you do a lot of admin work also. So you get to know how to handle a clinic, how to run a clinic. And in my hospital setup, I get to know how to do teamwork. So I think both are great as far as you get it at the right place. You have to have the right place, right private practice and the right hospital where you can learn from both the places as much as you want to learn.
And what are the 3 things you wish you knew as a student that you know now but wish you knew as a student?
Or just any 3 pieces of advice you would like to give to all students who are in college right now?
So yeah, I'll put this together. See, when you're in school, you're very, like in college, you're very secured, because you have your teachers and then you have no responsibility. Okay, so you realize when you get out, you realize that your responsibility towards the patient is very high, whether you know your stuff or you don't know your stuff. Okay, so that's one. Second, it's important to understand your patient. See, when you're at college, you're so involved in giving an exam. Okay, so you don't realize you only want to relate things to the exam. But as a student, it's important when you get out, it's important to know the nature of your patient, because you may know your stuff. It has happened with me that you know your stuff and you come to understand that this patient is very, very comforting and very very cooperative, but you'll also get patients who are really difficult and will throw a tantrum straight on your face, and you realize, where has this come from? So to even know, to understand that, you need to know your patients well. And the third thing, I feel, application. Okay, you can be a first class student, but if I can't apply, you come into this world and you feel like, okay, what did I learn? And that's exactly what happened to me. That when I came out and I realized that, okay, I'm only ultrasounding the shoulder, but I don't know what I'm doing. And where is this taking me through? So as a student, if the application part, which I think is very, very important, is taught to us, is required. Okay, and I would add two more things. One is ethics, because a lot of times, if you understand our professional ethics, if that's taught it in school, I don't know whether they teach you now, but if it's taught in school, I think all of them will benefit. It's important.
And ma'am, what is still driving you even after 30 years?
Yeah, I know. I just love what I'm doing, and what is driving me is when my patients tell me I'm so much better, and all the blessings which I get, I think that's driving me further, because I think that's very important. You know, when patients come and tell you that I can now sit, I can walk, I've had a headache for last 4 years, and in 2 sessions I'm feeling so good and I've forgotten what my headache is, it just makes you feel very happy. So I think it's the patient feeling good drives me, and most of the elders, when they give you blessings, I think that's what has got me here.
And ma'am, you also have few patients who are from Bollywood and etc. celebrities type of. So what are their problems? How it is different from?
It is nothing different. It's just the same. It's absolutely same. They're the same human body. They have the same problems of bad posture, maybe bad, shoulder impingement, low back pain, disc issues. They have the same problem. It's just that it all depends upon how they work, because, depending on what movie they are doing, I feel some of them have to overwork and do a lot more than what they need to, what their body allows them to do, and that's how they get injuries. When they don't have anything, when they don't have a movie, then they are more relaxed. So then again, they have different kinds of injuries, because as they say, I've been only watching TV the whole day. So then they'll end up having backaches, and they're all bad postures. So injuries are not different. It's only because they work differently, they get these ups and downs with injuries. Otherwise, it's just the same.
And ma'am, how can we improve the physiotherapy community overall more? It has improved from the past till now, but how can we grow it more? What are the things we can do? Everyone from who are practicing and who are students, how can they contribute?
No, so I would again repeat, like how you guys are sharing and spreading awareness. I think if there are many more who do that, because I know at our time we didn't have anybody like that, and I'm completely technology challenged. So I feel that if as physios, besides doing their job, if we are also made aware of getting the technology on a better scale, understanding business perspective, because at the end of the day, we have clinics, but we don't know how to run it. We don't know how to escalate it to another level. So I feel the finance and the business part, as physios, we really lack. So when you get out, I think it's important. That's life knowledge. And I think that either comes from your family, or it will come with sharing with your friends and experience, because maybe you may have friends who are in different fields who can help you out. So I think this is something, if we grow together, then we will, or rather understand that better, we can grow our practice to a better level. Like everybody wants to be individual physio clinics, and I feel if there are 2 good physios or 3 good physios got together and run the show, I feel our expense becomes so much better. Our patient turnover becomes so much better, because there is no competition. Like if I'm out of town, then you will take care of my patients. If you're out of town, I'll take care of my patients. Then we work as a team. I think that is something we lack, because everybody wants to do their own bit. And I always believe, how much can you grow individually? You must grow together as a team. And I feel if your team grows, you grow automatically. I mean, that's what has happened with me. So at my time, I didn't have anybody who I could share this, but I think now with newer generation, you can always, like if you 4 guys are together, start the clinic together. I think it just works fantastically well.
Ma'am, any parting message you want to give to all the viewers?
Just love what you're doing. Enjoy what you're doing. That's very important. Don't do it out of stress. And I think if you love what you do, you enjoy what you do, you will reach wherever you want to reach. That's the way I look at it.